Right, good afternoon, everyone. Hope everyone's doing okay. So I'm Kareem, and welcome to our Medentors webinar for work experience. So it's been a while since we had our last webinar, but we know that many of you in year 12, especially year 11s and year 10s perhaps, are sort of looking for work experience or have maybe done some work experience in medicine and dentistry. And it's an important part of the application process. So we've got two lovely mentors here today with us, Hannah and Aladdin, and they'll be telling you everything that you need to know regarding work experience. And before we get started, if you're new here, welcome to the Medentors community. We've got three branches. We've got our Academy branch, which helps you achieve excellence in your exams. So whether that's Key Stage 3 GCSEs or A-level exams. We've got our admissions sector, which helps you get into your dream medical or dental school. And then we also work with schools and communities on an interactive level to provide workshops. We've worked with about over 3,000 students, and many of them have gone on to get offers in medicine and dentistry using the same principles that we've taught. And a lot of them have done so using the plethora of the free webinars and guides that we have to offer. We're also partnered with about 20 schools and organizations, and 95% of students gain a place to medicine and dentistry who work with us. But without further ado, I'll pass on to Ala, Adine, and Hannah, who are going to take it forward from today. So thank you.
All right, hi guys. So my name's Aladdin, as Kareem has introduced me. So I'll be covering the first part of this presentation, and then I'll pass on to Hannah for the second part. So just a quick, sort of overview of today's plan. So we're going to go over why you need work experience. What's the point of it all? Because I think a common misconception is it's one of the minor parts or not very important parts, whereas hopefully I can convince you that it's otherwise for today. We'll look at how you actually get work experience and any alternatives. Is there anything else that you can do? Sometimes it's a bit difficult finding it, or you can't get enough of it. So, yeah, what else? Um, and then we'll have a look at some reflections and exemplars, and that'll be during the latter half. So, like what to do during your work experience, how you can reflect on it, how you can reflect on it well as well, because you can reflect on it but quite poorly. Um, then we'll go over how you apply it in your personal statement and interviews, so that links to the reflections part. And finally, we'll just have a Q&A at the end. So, with the first part that I mentioned, why do we actually need work experience? So, first of all, it's going to give you an insight to the profession. So, during your interviews, and even in your personal statement, you're expected to show that you understand exactly what it is to be a doctor or a dentist. You need to know what difficulties will come with it. You need to know what the work conditions are like, just what the job entails, what skills are needed, and you can read about it, but it will become a jumble of words. You won't be able to articulate yourself properly. So, seeing it in person is completely different. It's a bit of a cliche statement to say yeah, it's different in person, but it's a true statement. So yeah, once you actually do go into the GP or the hospital or the dental clinic or whatever it may be, you will notice things that you didn't know before. Even if you have family in medicine, or you think, I know exactly what this career is about, just being there for a week or two will give you something interesting that you didn't know before. So yeah, it'll give you an insight. It'll give you an awareness of practicing conditions, like I mentioned. So a lot of interview questions will circulate around what issues the NHS is facing, or for example, NHS versus private. The MDT, the multidisciplinary team, you will see that in action live on your work experience, and that is interviewers will love hearing about that. So yeah, make sure you mention that. And you will be surprised sometimes, if you see an emergency or anything, if you're lucky enough to get to spectate something like that, it will amaze you, even if you've seen TV shows about it or whatever. Like in person, it is really something different. And then finally, skills as well. So what skills does a doctor need? How do your skills align with that? And how does that apply to something that you saw in your work experience? And that last part, how does it apply to something you saw in your work experience? This is really your ability to reflect. So once you go on your work experience, the whole point of it is that you reflect. Because if you just go and just stand there and watch and don't think about what you've seen, it's not going to help. It's not going to help in your interviews or your personal statement, or helping you decide whether you even want to do medicine or dentistry or not. So, yeah. Um, then we've got motivation. So you, if you see the doctor or the dentist, and that's where you want to be, it's going to push you towards being that. So, like seeing the lifestyle that they have, not to say that it's an easy lifestyle, but it's hopefully the lifestyle that you're chasing. You like not only the pros of the job, but you're happy to take on the cons. You're happy to take on the stress because, like as it says, you're not an average student, so you're looking for something that's going to push you. So, like going on work experience not only shows you like the conditions of the job, it also makes you want to do the job more, hopefully. Or if it doesn't, then that could be a question to ask yourself whether you want to do it or not. And that kind of ties into the last point. So the most important question, is it for you or is it not? So how do we actually go about even finding work experience? So um, this is essentially, oh, should go to the next slide, sorry. Um, so how to find it? You're thinking about like so cold calls or emails or visits in person. Just, you've got plenty of GPs around. Your GPs are a lot easier, to be honest, to reach out to. But hospitals as well have a lot of employees, so you can go down that route. But the point is, ask and don't just ask like two GPs and get discouraged if they don't reply because I work in a GP myself. GPs are busy and a lot of things just get lost in the paperwork, lost in the admin email. Like, don't take it personally. It's not that they don't want to have students, is that there's too many people working on the same thing. So yeah, just try a bunch of different places. One of them should hopefully stick. It just, yeah, you need to try enough. And yeah, there's no shortage of GPs and even hospitals. It's not like you email one person in the hospital and just call it a day. So yeah, just be persistent with it, and then you'll get it hopefully. Then the next step, or do it in conjunction with the previous step, is ask your contacts. So, family. You don't need family in medicine to get work experience. This is a really common sticking point. So people say, "Oh, my mate, he's got a mum who's a doctor, so he managed to get work experience." It might be made easier, true, but like you don't need them in your direct family. Your family might have family who are doctors, or family friends who are doctors, or for example, your friend who has a mum who's a doctor, you can ask them for a hand. You'll be surprised, like it might not be very difficult for them to secure you that work experience. But just think, where can I reach a doctor through my connections, whether that be family or friends or anyone I know, and just give it a shot. Community centers is a great one as well. So I always mention like try your local church or your mosque. So they tend to push like these types of things. They like it when someone's interested in medicine or dentistry. They're classed as like good things to go into. So yeah, go through the community route as well. Um, your school should hopefully be a helping hand. So you're in sixth form now, so you will probably have a head of sixth. If you go speak to them or anyone who sort of designated themselves as like the head of admissions for sixth or anything like that, ask them. But as it says, ask early. There's no point coming towards the end of year 13 or even before that, like it could be a bit too late because you ideally want your work experiences to be done before you submit your personal statement and your UCAS application. So because you want to reflect on it in that and then also in your interviews, and you don't want it to be a tight time frame. Best time to really get into work experience is during year 12. Anything before is also good. But yeah, year 12 is that like phase where you really want to be pushing forward your work experience. So um, if you're going to stay in your same school for sixth form, ask in year 11, etc., year 10 even. If not, if you just gone to a new sixth form, just make sure you ask as soon as possible. Ask on Monday if you haven't already. And then finally, you've got LinkedIn. So the nice thing about LinkedIn is you make a profile, make it look, decent and believable. You're not like a bot, etc. From there, as long as you build like a couple connections, it will know who you want to connect with. All you need to do is press that connect button, and no one's really going to decline you. So it is really easy to build a LinkedIn profile if you really want a lot of connections. And the reason you're going to want a lot of connections is once you connect with someone, you can message them. If you see, like a doctor in Nottingham Hospital or something, and you live in Nottingham, press connect. 99% chance they're gonna accept the connection, and from there you can message them. Ask, hi, I'm a year 12 student. I go to this school. I really want to be a doctor. I've seen your page. Would it be possible for me to shadow you? Um, Again, it's kind of like the first cold email like thing. If you ask enough people, someone's probably going to say yes. But just as a final point, there is no reason to be paying for work experience. So work experience is you trying to like go out there and just see something. It's not like there's no reason to pay because it should be offered free, and it's almost like a duty for like hospitals and GPs and doctors and dentists. Like they should be offering this to younger people, like because same way they got to experience the job before they applied, you deserve to experience it as well. So anyone who's trying to charge for work experience, that's not ideal. Now, not to say every single paid work experience is a complete red flag or a scam or whatever, but like some of them are just trying to farm money, and the rest, the question becomes like, why should you have to pay? So you will be able to get plenty of work experience for free. It just takes like dedication. You need to be like consistently putting out a lot of requests for it. So, if you remember at the start, I said we'll also look at some alternatives for work experience. And the first one for that is going to be clinical volunteering schemes. So, you'll often hear this phrase put together, volunteering and work experience. They're the two like extracurricular things we really care about. So, in your personal statement, someone might have said, read a book and then write about it in your personal statement. That's all good or whatever, but that's not so crucial. However, if I'm really to pick like what is almost crucial to apply for medicine or dentistry, it is going to be volunteering and work experience. And volunteering, now clinical volunteering gets you into the clinical setting, and that's why it's an alternative to clinical work experience. However, do bear in mind, if something is volunteering but not clinical, that does not make it worthless. In fact, it's still very valuable for applying to medicine or dentistry. So yeah, if you're trying to get a feel for the clinical setting, obviously you're not going to get a feel for that in a charity shop if you're volunteering there. So that's why we've mentioned clinical volunteering. But please don't go away and think, I'm not going to volunteer unless it's clinical. It really is like, it's still just as valuable. Second option is going to be any sort of like primary care settings like pharmacies, care homes, hospices, any long-term volunteering there just shows your dedication. So if you manage to volunteer in a care home for a year, imagine a whole year of consistently going to a care home, you will hear a lot of stories, you will see a lot of amazing things. You'll essentially, be going through it for a year. Like it is difficult to volunteer in a care home. It's very like emotionally draining, physically draining, even tiring. Like you will come out a different person. Again, a bit of a cliche, but you will come out a different person. So just bear in mind that that sort of setting doesn't just need to be a hospital or a GP. Anything that's dealing with patients is valid because at the end of the day, you're going to be dealing with patients. And as a doctor, you need to be very, like well versed in what happens in a pharmacy or in a hospice. You're not just you in your own clinic in your own room. So yeah. Finally, online work experience. This became almost like a more of a trending thing after COVID. And the trend has continued. And this is great because unis now accept that they need to take a work experience. Not all of them, but some of them. So, and we'll get into that. So, Medentors is going to offer you work experience. So, if you're looking for a place to start, look no further. But, most of the other like admissions companies as well, they all offer online work experience. Again, should be for free. So, go out there and just catch whatever you can, whether that be with us. And if you get online work experience with us, don't stop there. See if we've got any more or if anyone else has got any more. Because the more you do, simply the better. And it's online, it's free. You do it from the comfort of your own room. You can't go wrong. Um, but yeah, some unis do accept online work experience, some don't. And hopefully after COVID, the acceptance for them is only going to increase. But just bear that in mind. Like getting in there in person is ideal, is more ideal. So if we're just thinking core values in your work experience, um, think communication. As you probably know, communication is You've heard it cited 100 times already if you're looking to get into medicine or dentistry. So look at how the doctor communicates not only with anxious patients, but also, and this follows on to teamwork, how they communicate with their other colleagues, so other doctors, how they speak to a nurse, how they speak to the receptionist, etc. So yeah, communication is not only done like via the doctor-patient relationship, is done across the whole clinic or hospital or hospice or wherever it is. Like you cannot get anywhere without good communication in this field of work. Um, yeah, and a sort of subheading of that would be teamwork. So how do you communicate with your team? How do you liaise with your team? How are you able to work effectively? So we've got the MDT mentioned there again. That is a key phrase I want you to use a lot. So multidisciplinary team. They love hearing about it, interviewers. The university admissions team love seeing it in your personal statement. In general, the MDT is just a really important phrase to wrap your head around. So multidisciplinary, you've got different disciplines. So it's not only the doctor, it's not only the dentist. You've got a nurse, a HCA, receptionist. All of them contribute in their own way. So you need to think of it like that. Um, so time pressure and prioritization. So you will see that a doctor is or a dentist is really they're really busy people. You cannot have a doctor or a dentist who doesn't feel time pressured 24/7. It's just the nature of their job. So look at how they prioritize what needs to be done because there will come a time when you need to prioritize what needs to be done. And this is a commonly assessed point in interviews as well. How do you deal with time pressure? How do you prioritize? And if you are asked okay, how do you prioritize these 5 tasks? Think back to your work experience and link your response to the work experience. This is how it all ties in. I've got confidentiality and professionalism. So working with any healthcare professional, even if you're just working with the receptionist and a GP, no clinical input whatsoever, confidentiality is it's a part of every single thing that they do. Whenever they speak to a patient, which is all the time, they need to keep it confidential and they need to keep it professional. So you will see patients who are quite rude. You'll see patients who don't appreciate what the doctor is doing or want to cause an issue or even, shouting or whatever. Showing that professionalism and knowing how to show that professionalism. So if you watch a doctor show it, then you'll know how to show it. Is another skill that you'll be assessed on. Yeah, for example, a role play in an interview. And then that ties into managing difficult conversations. And then finally, emotional resilience. So that also ties into professionalism. So keeping yourself professional when you might feel emotionally under stress. But yeah, you'll see how no clinical job is completely emotionally easy. Even if it's not emergency medicine, you're working in A&E, even if it's, you might look at it from a dentist point of view where they tend to deal with less emergencies just seeing how someone is affected by their smile or something and they're self-conscious about their teeth, that in itself, you've seen that every day, that is quite like it's quite emotionally provoking. You feel sorry for some patients. So yeah, look at how your dentists and doctors deal with that. Sometimes that's done from within, so best thing to do is just ask the doctor or dentist that you're shadowing, how do you deal with the emotional aspect of it? So I'll pass on to my colleague Hannah from here.
Okay, can everyone hear me? Yes, hopefully. Yeah, good. Okay, so in terms of navigating your work experience, now that you have hopefully done some or secured some, or maybe later down the line, we want you to not only have the work experience, but you also need to, most importantly, be able to reflect. And the way that we like to do it at Medentors is to cover 4 main steps. So with step 1, we want you to describe what it is that you saw. Like essentially set the scene for the interviewer, set the scene for the person reading your personal statement, listening to your interview, whoever it may be, right? So maybe 1 or 2 sentences with no excessive details. We don't want everyone's name, everyone's role, everybody, the dates that all of this happened in. Just something to set the scene and give us an idea of what you're going to be reflecting on. right? With step number 2, what traits and skills did you observe on your work experience there? So this is where your insight to your experience really begins, right? So we want you to start thinking about communication, about teamwork, about decision making. Did you see these kinds of things happen on your work experience? And if so, how did you feel about them, right? Are these the kinds of skills that a doctor would need to, or a doctor or a dentist would also need to use in their day to day? If so, make sure that you're mentioning them by name and not just thinking that because you've mentioned the experience, the person reading your personal statement or listening to your interview will also just know, right? Um, and of course, like always remember empathy and professionalism throughout as well. And then with step number 3, how have you, now that you've had the experience and that you've recognized what skills and traits were being observed, how have you then gone on to your, day-to-day life or whatever it is that may be and applied these traits, right? For example, if you watched someone have some really good teamwork or some really good leadership skills, for example, a doctor or a dentist with the other members of their team, how have you gone with your own team that you manage or that you are leader in, and how have you applied those skills? How have you applied them through your volunteering, perhaps, and make a link through that, through like teamwork and sports and other leadership things that you do as well. And then with step number 4, how does this relate to your degree or career that you've chosen? So to medicine or to dentistry. This is where you will show how even like you've used these skills and you've seen these skills and now you've applied these skills, and because of that you are so much more motivated because you will also apply these skills in your career, right? And you can show growth in this step. You can show that you have an understanding of the responsibility that you will have, and that the kinds of qualities that you would need to display, and things like that. So again, like 4 really good steps for you to think about and make sure that you remember throughout your personal statement, and especially through once interviews come around. Thank you. And then this slide now, I'd like to think of this slide as kind of the checklist that an interviewer would have in their head when they're looking at either your personal statement or interview time. How have you now that you've done your work experience, how you're reflecting on it, right? So some do's and don'ts. Let's look at the green flags first. So reflection, right? How are you just telling me what happened, or are you reflecting on it properly? Are you just telling me, oh, I watched XYZ surgery and that was it, and moving on. I watched this surgery and I sat in this doctor's office and I volunteered at this place, and then you move on to something else. No. If you're going to speak about your work experience, make it worthwhile. Make sure that you're reflecting, make sure that you're speaking about the skills that you observed, how you've applied them yourself, and how these will apply to your career. Again, those 4 steps that we spoke about. Second one, make sure that you're including a variety of work experience. You're not just doing tons of one type, because there's only so much that you're going to learn from them, right? So instead of perhaps going to 3-4 hospitals, watching a whole bunch of surgeries, or spending one day each in like 3-4 different GP surgeries, consider having a mixture of some clinical, some non-clinical, and then maybe something that's completely unrelated, like leading a team at your school, something like that. And then step number 3, appreciating the challenges of the career that you've chosen. So yes, you've done your work experience. You've seen that these doctors or these medical professionals, these dentists, it's not all sunshine, right? They're going to have difficulties. They're going to have NHS pressures. They're going to have patients that aren't going to be very nice. They're going to have emotional burdens, long hours, all sorts of things. And through your work experience, hopefully, because of how much time time you spent with them, you will also have come to recognize these. We now need to see that you, despite all of these drawbacks of the career that you've chosen, you are still motivated, and you're still motivated and you still want to go ahead, so that even though you're acknowledging this difficulty, you are still you still do want to go ahead and do it, so that you can make, a mature and resilient choice about your career. And then another way to make sure that another way to tell them how you're going to be so resilient about this is perhaps making sure that you're including how you have support systems in place, how you have coping strategies, how perhaps you've seen doctors manage their lives outside medicine, things like that, and dentists, of course. And then quickly through the red flags, you want to make sure that you're not just including lots and lots of unique descriptions but no reflection. So, for example, I watched this cool surgery and this brain surgery and this and that and the other, but you're not reflecting on anything. There's no point to it, right? Because everyone can start listing things. Everyone can go and sit in different doctor's surgeries or dentist offices, but not everybody can then take those experiences and reflect on them accordingly and apply them to their practice and life. So number 2, time length but no consistency, right? So imagine you would so much rather, and an interviewer would so much rather see someone that has spent 6 months at one care home or 6 months in one hospice than 6 hospitals, but each of them was 1 day each. Because it's through consistency and through showing your commitment that you can then reflect on things properly. Because if you're not there each and every day, or if you're not there for an extended period of time, how are you going to see both the pros and the cons? How are you going to see both the good times and the bad, right? And then another one, with interviewers, it's very easy for them to see, and people reading through work experience and anybody else that's assessing your application, it's very easy for us to see if you're just doing your work experience to tick a box, or if you're doing just anything to tick a box, really. Like if it sounds like it's from ChatGPT or if it sounds like it's from Google, they're going to know. So make sure like you're genuine throughout this all, and the way to do that is to make sure that you're reflecting properly and that your experiences are personal to you. And then lastly, make sure that you're not putting down other healthcare professions. This is like something that a lot of people unfortunately fall into. You speak so much about how much you want to become a dentist and how much you want to become a doctor, but in the means of it, you'll accidentally say, oh, because nursing is XYZ, or because dental hygienists just do this and that, so I wouldn't want to do that, and because their role is just this and that. You don't want to do that because it shows that you have no care for the team around you and you have no respect for them. That's not something that a medical school or a dental school would want in their students, because we want to make sure that everybody between professions is able to collaborate and communicate effectively and just have good teamwork to have the best outcomes for the patient. If you're not showing that from before even you get into medical school, when they're not expecting that you will be able to turn things around by the time you get in. Thank you. Okay, so moving on. Now that you've understood how to reflect accordingly and what are some, green flags, red flags about the entire reflection process itself, how will you then use your work experience in your personal statement, right? So we want to first make sure, remember, like the 4 steps that we spoke about before, you want to describe, you want to make sure that you mention the skills, you want to reflect upon them, how they made you feel, how you applied them, and then how they will apply to your link to medicine. So brief context, 1 or 2 sentences, again, just set the scene so the interviewer knows what kind of thing they're about to either read or you're about to speak about. Insight, what skills was it that you observed? Even if your experience wasn't clinical and it wasn't exactly you seeing some doctors or seeing some dentists, whatever experience it was, you will have observed the skills that are relevant. You will have observed things like leadership, things like teamwork, things like empathy, making sure that you're mentioning those by name and then then next on to the next point, linking them to how you applied those skills and your qualities, those skills and qualities to your own life, really. And then lastly, making sure that you're linking to medicine or dentistry. Why are these skills so important? How do doctors apply these skills? Why is it important for them to apply? What could be some drawbacks of them not applying such skills and things like that? Um, okay, so if we just look at some examples now, if I can ask everybody to take a minute or two to just have a read through this. And then we're gonna ask you guys to just give us some points, what are some things that have been done well, just some feedback for this applicant, please. If I can get some thumbs ups once people are done reading and ready to feedback. Okay, one. Okay, good. I think most people are done reading. Okay, good. Does anyone want to take the lead on this? Maybe give me 1 point, just one feedback point. How do they think that this applicant did? You can either write this in the chat, or unmute yourself. We're happy with either. Come on, guys. They didn't reflect. Yeah. Lacking some information since they aren't specifying what skills they observed and plan to use in the future. Yeah, yeah. They told it more like a story rather than reflecting what happened. Yes, again, no reflection, no relation to the degree. Yes. Okay, good. I think that's enough. I can see like you've all been listening, one, and you've all like managed to give them some good feedback. So I know now that when it comes to writing your own personal statements, you won't be making these mistakes, right? So we can see from this that they've done quite a lot of like really good work experience, and like it's really thorough and relevant, I guess, but they haven't told me what they've learned from it, right? They've got to show understanding. Eh, yeah, yeah. Quarter. All right, guys, enough. I can't keep reading. Okay. Yeah, they've done lots of work experience, like some fancy quote unquote work experience. However, they haven't really reflected on it. They didn't use the 4 steps that we spoke about with Medentors. Um, Time period, nothing wrong with mentioning it. Yeah, if it doesn't take up your word count. Do you think that with those words, do you think you could say something better, say something more worthwhile, reflect a bit more, Um, Again, they didn't really show any personal development through this. They didn't really mention any skills specifically. They just described their experience very well, right? So let's move on to the next one, and then we'll see how this applicant wrote their personal statement and reflected. And then we can compare the both of them. So again, like just a minute, and then some thumbs ups once you're done reading, please, guys. Okay. Yeah, it's about half-ish of you, most of you done. Um, yeah, okay, good. So, would anyone want to take the lead on this time? Or just spam the chat like before? It's also okay. I'll zoom through them. You can also unmute yourselves, guys, if you want. They mentioned skills, yes, correct. What else did they do? I think they did a lot more than that. Deep reflection, yes, good. Back to relate back to my career. Talk about land. Heightened definition. Yeah, yeah. Future career. Yeah. Any more ideas? Appreciates challenges, yes, good. Okay, I think
Just gonna
that's
come in
all.
and say, I'm just gonna come in and say one thing. The whole point with the application, right? The applying of the skills, which you've all identified, right, is you're gonna have thousands upon thousands of people applying to medicine and dentistry every single year. And the medical and dental schools, they need a way to screen off these people, right? They do it through the personal statement and through the interviews. The whole point is if everyone's saying the same thing, describing the same thing from work experience, oh, I saw this heart surgery, or I saw this filling, the dentist, or I saw this, everyone's going to sound the same. The application of the skills shows that deep reflection, but it also makes it personal to you because there's an infinite amount of combos where you can have work experience and how you've applied that certain skill or trait. For example, someone mentioned photography or videography earlier on, or there's pottery painting. There's so many different things that maybe can relate to manual dexterity, or volunteering at different places can relate to communication and teamwork. The whole point of this is they want to see that deep reflection. And also, this is what's going to make you guys stand out. Because if you think about the odds of applying to medicine and dentistry, how you're going to get in, it's very competitive, right? The rates are about 30% for medicine, 10% for dentistry. How are you going to beat those odds when everyone else has the same grades? Everyone else is going to have work experience. Everyone else is going to have volunteering and so on and so forth. It's these things that make it personal that the admissions teams at medical and dental schools will like. Sorry, back to you, Hannah.
No, it's okay. Thank you for adding that, Kareem. Okay, so we'll just run through this for the sake of time quite quickly and then we'll move on. So again, like I think everybody mentioned really good points. I think we all have like a good understanding of what is a good piece of reflection now, I think, making sure that you're not only giving a good description of what it is that you saw and the wide breadth of things that you saw, but also the exact skills and how this webinar counts as work experience. Probably not. um, um, yeah, the exact, oh, I think, yeah. Not only the exact skills and things, but also making sure that they're then linking back to medicine and making sure that it's personalized. And yeah, moving on. So, now that you have hopefully aced your personal statement and gotten your interview, how are you going to use this work experience that you work so hard for, to make sure that you smash your interview, right? So, work experience in your interviews and your MMIs, your panels, or whatever it is, builds on what you mentioned in your personal statement. Yes, it's true that some universities won't look at your personal statement, but a lot of them still do, right? So you want to make sure that you're able to take the experiences that you mentioned in your personal statement, and then if an interviewer was to ask you, "Oh, tell me about this that you mentioned in your personal statement," you mentioned watching this surgery, you mentioned being in the dentist's office or doing so and so. What did you learn from this? What kinds of skills did you take from this? How did you then apply this learning? You need to make sure that you're able to use this knowledge that you've learned and communicate it effectively, right? Reflection is the key aspect. Remember those 4 points that we spoke about earlier. Right? The different ways that an interview can test your work experience essentially is through a few different types of stations. So, for example, you could get some communication stations where they are directly expecting you to tell them what it is that you observed and what this has taught you and how this has altered or perhaps reinforced your drive to pursue dentistry or medicine. You get some role play stations. I'm not sure, like I think a lot of you must be still quite early in your application process. Maybe you haven't had as much exposure to interviews. But another interview type that you could have is role plays. And in role plays, we want to make sure that you're like given that you had clinical experience perhaps, or you watch doctors do XYZ, you watch dentists do XYZ, when you then have those scenarios, you're then using the same kinds of phrases, the same kind of mannerisms and body language and things as such that they were applying to make sure that you are being as genuine as possible and it isn't rehearsed and it feels reflective, right? Another type of question that you could have, a station that you could have, is one on the NHS and system pressures altogether. So because of the length of time or the experiences that you've had, you've now seen the kinds of challenges that a dentist or a doctor encounters in their day-to-day practice. You've seen how like low budget affects their practice, how perhaps some difficult patients, how having long hours and emotional stresses and all sorts of things, how they can affect their practice, and how these dentists and doctors then mitigate those challenges, right? How do they manage their time outside of their work-life balance? How do they manage the challenges whilst they're on the job as well? We need to see that you're appreciating these challenges and that they're not putting you off medicine or dentistry altogether, but that you're able to reflect on them accordingly, and then, switch things around in a way that shows that you are still motivated. Yeah, I think that's the end of my session. So of my section, I'll turn it back to Kareem now.
Right, thank you, Hannah and Aladdin. So that was a very concise but hopefully really useful overview of all the different types of things with work experience. In terms of what's next, what we have to offer, we have a lot of online free webinars coming out. We've got one next week on Saturday for mocks and exams. I know a lot of you will have your mocks in year 12s, some year 11s, you might have your GCSEs as well. In year 10s, you'll have your mocks and, all the way lower down. So we're going to have this webinar on how to deal with mock and exam stress. And the following week, we'll have a personal statement webinar on sort of identifying what the things that you need, the ingredients that you need to put all together for a personal statement. And also, in late March, we'll have another webinar for Inside the Life of Medical and Dental Students. So you can find out what is it like being a medical or dental student. We also do have a society webinar coming up. So a few of you have asked what we sort of offer in terms of online work experience. The Medentors Society has webinars sort of almost monthly with doctors and dentists that sort of come on and speak about their patient cases or what their work is like or what some of the challenges are like. And actually, that's a form of online work experience that's all provided for free as well. So do keep in touch with us. We also have, for the first time ever in Medental's history, a in-person event on the 30th of March in Manchester. So more details will come out soon about that, but keep that in your diary. That will be in the Easter break. and it's open to year 9 to 12s who are interested in medicine and dentistry. We'll have a lot of our mentors that are going to talk about all the different hurdles and how to sort of navigate that. And it will be quite low ticket as well, something around in the range of £10. So it will be really, really valuable for you guys. Um, but this is also a little promo of our webinar next week for Stop Panicking, Start Studying. And if you join this webinar, we're doing an early release of our productivity guide, which the team has been working hard for. So sort of how can you make the most of your time? What's the best way to revise? That sort of thing will be covered, and also how to deal with stress. It will be led by a panel of students who got 3 A stars in their A levels and all nines in their GCSEs. So I'd definitely join. And in terms of how to keep in touch with us, do join our WhatsApp community and follow our Instagram for more tips, more webinars, more resources. Um, Recently, we have been putting more of a push on Instagram. We'll have carousels of tips for admissions and all sorts. So do check us out. If you're not in the WhatsApp community, um, scan the QR code to join. I am aware that you guys, you know, you can't scan the QR code because you might be on your own device. If you can't scan the QR code, go to medentors.co.uk/links. I've also put it in the chat for you guys so that you can access our WhatsApp community. It's all for free. We've got mentors that answer questions on there daily. We've got loads of webinars that we announce on there as well for free, guides, articles, resources, all sorts. And again, it's a nice thing to have a community where there are other people applying for medicine and dentistry, not just you, so that you can all make it through. And that's the community that we try to sort of thrive ourselves upon. So I've put it in the chat, medentors.co.uk/links. Do have a look at that. And our academy also offers tuition if you guys are struggling with that. So head to medentors.co.uk/academy if you want to book a free consultation. And yeah, that's sort of the end of the webinar. Without further ado, we've also got our Q&A panel. So if you've got any questions, leave them in the chat and Hannah and Aladdin and I will answer them. But that is sort of the end of the webinar. Thank you so much to everyone who's come. Any questions, do leave them in the chat. And yeah,